Welcome back. Here we are going to go through some early knee exercises in phase 1. We have classed phase 1 as the first 2 weeks following the injury. As I mentioned in the previous video, research supports a criteria-based progression through the phases rather than a strict time-based progression. This means that you may be able to progress to the next phase a little earlier than the weeks stated, or that it may take a little longer. Progress when you feel ready and as the pain allows. As for how often and how many, this will vary from person to person and depend on your stage of recovery. In the early stages, we often recommend doing the exercises little and often, perhaps 6 to 12 repetitions, 3 to 4 times a day. As you progress, aim to increase the numbers gradually as pain allows. Aim to progress to 8 to 15 repetitions, 2 to 3 sets in that little session, 4 to 5 times a week. As you improve, you should aim to do enough reps and sets to get to the point where your muscles feel fatigued. The first exercise is active or active-assisted knee range of motion. Here we are going to use a towel or the rope of a dressing gown to bend and straighten the knee. Aim to straighten the knee as much as you can to ensure you regain full extension as pain allows. As you are able, progress to not using the towel. The next exercise is the static quads exercise. In a long sitting position, either on the bed or on a sofa is fine, tighten up your thigh muscles to fully straighten the knee. Hold the contraction for 5 to 8 seconds and then relax. Then we have the inner range quads exercise. Roll up a pillow or a towel and place under the knee so it is in a little flexion. Straighten the knee to lift the ankle up. Hold in this position for 5 to 8 seconds and lower. The next exercise is the straight leg raise. Fully straighten your knee by tightening your thigh muscles like in the static quads exercise, then lift your leg off the bed and lower. We then have sitting knee extension. In a sitting position, fully straighten the knee. Hold for 5 to 8 seconds and lower. That's the end of this phase 1 video. These exercises can also be found on the physiotherapy section of the Addenbrooke's website under patient information leaflets, where you can click on early knee exercises. Thanks for watching. See you at phase 2.